So we'll be talking about cysts in the breast. So what exactly are they? They are a very common thing that happened to a lot of different women, and they are just a fluid-filled structure or sac that happen in the breast. There are two types of cysts: simple, which are just fluid-filled, and then complex, which usually have some type of debris in that fluid. And that could be anything from pus, blood, or milk of calcium crystals. Now, cysts are usually almost always benign, and they can happen in women from many different ages. Typically, it's 35 to 50 years old, usually younger, premenopausal, or postmenopausal women who are taking estrogen. With increased hormone levels, there can be an increased risk of getting cysts. Cysts occur in the terminal ductal lobular units, or TDLUs, when the extralobular terminal duct becomes blocked. With that, fluid accumulates faster than it can be reabsorbed. Cysts are usually round or oval shaped. They have well circumscribed borders. They are usually wider than they are tall, and they're usually very freely movable within the breast. A lot of women also have pain associated in the area that the cyst is in, which is totally normal. The size and shape of cysts may vary and kind of come and go with menses. Women can have one cyst, or they can have several cysts, and they can have them in one breast or in both breasts. The prognosis of having cysts is great. They are almost always benign, and having one or more cysts does not increase the risk of getting breast cancer. And as you can see in the image below, this is kind of what normal breast tissue looks like, and you can see the little oval round area, which is a cyst. The treatment of cysts usually isn't needed, but if the cyst is large enough and is causing the patient discomfort and pain, it can be drained. And how that's done is with a fine needle aspiration. That area of the breast is numbed, and then a needle, which is usually guided by ultrasound, is inserted into the cyst and the fluid is drained. Typically, the fluid from a cyst is green, brown, or tan. However, if the fluid is blood-stained, a cytology will be performed. Also, just because a cyst was drained doesn't mean that that cyst can't fill back up with fluid. So the doctor may want to set up a short or long-term follow-up to monitor that area that the cyst was in. And as you can see in the picture under the treatment section, this kind of depicts what a fine needle aspiration is and how it's done. We can see cysts in both mammography and sonography. Sonography is primarily used to diagnose cysts, as we can determine whether or not that mass is filled with fluid or if it is just a solid lesion. In mammography, a cyst typically looks like a low-density mass that's outlined by a dark halo. And you can see in that picture, there's kind of like a dark edging around it. In sonography, cysts are typically characterized as anechoic, which just means black, as well as acoustic enhancement, which is just kind of a white shadowing under that lesion, as you can also see in the picture below. Now, it's always a good idea to monitor your own cysts and do breast self-exams monthly to monitor the cysts and see if there's any changes to that area or if there's any new lumps or abnormalities that may be there. By doing so, you can become more comfortable with your own breasts and what they feel like. And if you do find any new lump or abnormality, it's always good to get it checked out by a healthcare provider just to catch anything early.